Welcome to today's podcast, where we shine a spotlight on a critical but often overlooked topic: prostate cancer. Prostate cancer is one of the most common cancers in men, yet, early detection and awareness can make all the difference. Today, we are joined by Dr. Tanmoy Mandal, a renowned medical oncologist at Manipal Hospitals, Kolkata, with an MBBS from NRS Medical College, MD from Calcutta National Medical College, and DM in Medical Oncology from Tata Memorial Hospital, Mumbai. Dr. Mandal is recognized for his expertise and dedication to advancing cancer care. Thank you so much for joining us, sir.
Thanks.
So, quickly moving on. What is prostate cancer? How does it develop in the body?
So, see, a prostate cancer develops in the prostate gland, which is in the males. It is seen. It's a disease of the males because they only have this prostate gland. So, the reason for development of prostate cancer is that if there is abnormal proliferation of any malignant cells or in the cells within that prostate gland, and that takes a turn into a malignant cytology. So, this is known as prostate cancer. So this is the way how a prostate cancer develops, or what is a prostate cancer known as. This is what is known as a prostate cancer. So if you ask that how does it develop, it develops mainly because of chronic irritation of the prostate gland. It may be due to some genetic reasons. Mostly age is one of the factors where we see that these are mostly associated with the development of prostate cancer. If you ask any specific reason for the development of prostate cancer, there is no such specific reason that yes, smoking causes it or alcohol causes it. They are also associated causes, but yes, there is no specific reason for the development of prostate cancer.
So, Dr. Mandal, why is early detection so important in prostate cancer?
You see, prostate cancer, the best part of a prostate cancer is it's a very slow growing disease. It's a modest disease to begin with. It, generally, the life expectancy of prostate cancer is very good, is very high. Many patients live for long, even if detected at a later phase, even if detected at an advanced phase. We see that most of the prostate cancer patients live for a very longer duration of time just because of the nature of the illness, the biology of the disease. Mostly the biology of the disease is a good biology disease because the patients live for a longer time. So early detection plays a role because if the patient is detected at an early stage, it's a curable disease. We can cure the disease in totality. And if cured, the patients can survive for a much more longer time. And it's a disease of the elderly. It's not a disease of the younger at an age of 25 or 30. This is not a common disease at this age. Generally, it develops after the age of 50 years. So if we can extend the life of a patient from 50 years to around 65 to 70, then I think we do a good job for those patients also. So early detection is very important because it gives a chance of complete cure.
So, sir, as you mentioned that it is a disease of elderly, so who most likely to get prostate cancer? Are there some men who are more prone or more at risk for developing this cancer than the others?
So, see, there are factors which might lead to the prostate cancer. One of them being the genetic factors. Around 10 to 15% of the prostate cancers are mostly developed due to the genetic factors. So, what are the genes involved? The most common gene which is involved is known as the BRCA1 and the BRCA2. They are known as the most important genes for the development of prostate cancer. This is also the gene which also leads to the development of breast cancer and the ovarian cancer in many patients. In the similar way, so this prostate cancer is also associated with BRCA1 and BRCA2 mutations. So that's one of the reasons for the development of prostate cancer. What are the other reasons for the development of prostate cancer? Smoking, alcohol, overweight. These are also some other causes of development of prostate cancer. One reason just I wanted to say that repeated prostatic infections due to diabetes or any other reasons is not a factor for the development of prostate cancer. So prostatitis, or what is known as inflammation or infection of the prostate, is not a predisposing factor for the development of prostate cancer. So that we need to remember, that recurrent urinary tract infections or recurrent prostatitis is not associated with the development of prostate cancer. Rather than these other factors are associated, may be associated with the development of prostate cancer.
So, thank you so much, sir, for debunking the myth that repeated infections don't cause prostate cancer. So, at what age should men actually start getting themselves checked for prostate cancer?
So see, screening of prostate cancer is a strategy which we are using now, and screening generally starts. This is known as screening to early detect the patients who will be suffering from prostate cancer. So screening starts from the age of 50 years. Generally, we recommend to start at the age of 50 years. So from the age of 50 years, what are the tests we need to do? We need to do a prostate specific antigen known as the PSA testing. That is one. And also you need to be checked by the urologist or a surgeon to do a digital rectal examination. You need a digital rectal examination to do whether the prostate gland which is felt by the rectal examination, whether it's a hard prostate or whether it's not a hard prostate. So if it's a hard prostate along with an high PSA levels, so there is a high suspicion that there might be the development of prostate cancer. So every 1 to 2 yearly, everyone needs, after the age of 50 years, they needs to check the PSA levels along with the digital rectal examination.
So, if someone has prostate cancer, are there any obvious signs they can look out for?
So, see, what are the symptoms we look for a patient whom we think that this might be having a prostate cancer is that this is in collaboration, we call it as a lower urinary tract symptoms. What are the lower urinary tract symptoms? Like these patients might be having nocturia, that means increased frequency of micturition at the night time. There might be a feeling that their bladder is not emptied totally and they might need to go to the bathroom for multiple times in a short span. It might happen that the patient is having urge to pass urine, and before even reaching to the toilet he passes urine. And also some burning sensation during passage of urine. These are certain symptoms which might develop or which might give an insight that these patient is having lower urinary tract symptoms, and these needs an evaluation for the development of any prostatic malignancy or not. These are the local signs. Of course, if the patient's disease has spread to the other parts of the body, mostly it spreads to the bones, we need that the patient has symptoms of any bone pain or any back pain. These are the other symptoms which the patient might also have.
So, sir, if we have to sum up into five alarming signs where a patient should definitely go and visit their doctor, what will they be? Five signs or five symptoms?
So five signs: one is arch incontinence, one is stress incontinence, one is nocturia, that means increased passage of urine at night, any hematuria, any passage of blood through the urine, and of course low back pain at an elderly age. Age is the most important factors. After 50 years of age, each and every man need to be cautious about this.
Thank you so much, sir. That definitely will help our audiences listening here. So, if cancer is caught early, what are the chances of a good outcome?
See, prostate cancer can be detected in an early stage. So how do we stage a prostate cancer? It can be a localized disease, it can be a locally advanced disease, or it can be a metastatic disease. So localized disease is mostly treated with surgery with a very good outcome. Around 90% of the patients are cured, 90 to 95% of the patients are cured with surgery. Locally advanced disease might require initial phase of a hormone therapy or some radiation also, or they might also go ahead with the surgery if feasible, if the disease is so localized. But mostly locally advanced disease are mostly treated with a radical radiation therapy in most of the instances. If it's an advanced disease or a metastatic disease, we treat with systemic therapy in the form of chemotherapy or some tablets. These are the treatment modalities for the treatment of prostate cancer.
Thank you so much, sir. So, is there anything that men can do to lower their risk of getting prostate cancer? Any tips and tricks?
So the only tips and tricks is that to maintain a good healthy life, to decrease the weight, to avoid smoking and alcohol as much as possible. No smoking should be advisable. And of course, after the age of 50 years, always get yourself checked with a PSA and a digital rectal examination at a regular interval.
Thank you so much, sir. So, after this, a lot of men don't really talk about prostate cancer. How can we change that? It has become like a taboo. No one talks about it. Breast cancer people still talk, but no one talks about cancers in men.
So that's mostly because of the awareness, and you see that prostate cancer is basically a good biology disease to begin with, and it's a disease of the elderly. So I think due to some social issues or whatever, many feel that if I get noticed about this, that I am passing urine within when I am not in the bathroom or all this, they might feel socially challenged. That's one of the issues. So the most important point to enhance this is to have a good awareness regarding this. We need to put more programs, more awareness camps during this prostate cancer month and all through the year. This will help out to increase the awareness regarding this. The way the breast cancer awareness has developed, we also should, in the similar way, we should also be aware of prostate cancer. So increased awareness is the only thing what we can do.
Thank you so much, sir. That definitely helps. So, any concluding remarks or message for all the audience who are watching here, families, friends, and patients, what they should do?
So, to everyone who is watching this program, whatever age you are, whatever old you are, wherever you are located, the most important point regarding prostate cancer is don't hesitate these lower urinary tract symptoms, especially at an elderly age after the age of 50. Reduce the weight, reduce alcohol, reduce smoking or stop smoking. That's most important. And do a PSA after the age of 50 years if detected, if symptomatic or even if not symptomatic. For high risk individuals like who have a genetic history or a positive family history, you need to screen at an early age. And be healthy and stay safe.
Thank you so much, sir. That definitely was an insightful session, and all our audiences will pick up a lot from here. Thank you so much.
Thank you.